Guys, welcome back to my YouTube channel. So today's topic of discussion is palpitations. Now, how to take a history of palpitations in a patient. As I have said earlier, that when the first three questions will remain the same, they will tell you the extreme, core reason of palpitations. So when did it start? It will give you acute and chronic case. When did it start? How did it start? What you were doing when it started, right? So this will give you a hint about the acute case and the root cause of the diagnosis. Then comes the, can you please describe the feeling when the patient is having palpitations. Palpitations means the inner sense of feeling the heartbeat, right? So when you ask the patient that describe it, please, he will tell you that the sense of feeling comes and goes. You feel he feels like a heavy thromby stumping pain, not pain but the sense of feeling of heartbeat, right? Similarly, he can also say that the palpitations comes and goes, and they feel like a missed, he feel like a missed beat. Sometimes that he couldn't feel his beat, sometimes he can overfeel his beat. So all these are important in the history of palpitations. Next is the two main important questions: any factor, anything that worsens it, any factor that relieves it. Now the factors that worsen is usually in a patient will give you history that whenever I have anxiety I feel palpitations, whenever I take coffee cups I feel palpitations. So all these are worsening factors, so you should keep this in mind. Similarly, that relieves it, whenever I do yoga, whenever I do exercise, whenever I feel with someone is I'm surrounded with people. So this will give you a hint about the idea about palpitations. Why is he having palpitations? And next is is it continuous or comes and goes? It will give you a big hint about the kind of palpitations. There are certain factors of palpitations. Palpitations is actually the sense of feeling of heartbeat. So what can be the reason? It can be atrial fibrillation, it can be paroxysmal tachycardia, it can be ectopic beat, it can be certain other factors, thyrotoxicosis, diabetes. All these extra systemic manifestations, you will get to know about this in the past medical history. When you will ask that is there any medical illness, you have any idea, or you are diagnosed with any medical illness, he will say that yes doctor, I have been diagnosed with thyroid disease 5 years ago. So you will get to know that it may be because of palpitations. So you will ask the questions related to the thyroid. Do you feel any intolerance to heat? Do you have bulging eyes or anything like that? So this is all about palpitations, right? Thank you.